Hi everyone, welcome back to my channel. Let's talk about health facts that people keep getting wrong. In today's video, I'm going to be demystifying PrEP. PrEP stands for pre-exposure prophylaxis. If you're not really sure or your knowledge around PrEP is a bit rusty, go watch this video that I shared earlier about all things PrEP, what PrEP is, who should take it, who shouldn't, what it does, all that jazz, and then you can come back and watch this video. So in this video, what I'm going to do is I will be busting some common myths about PrEP that are still spreading, particularly in South Africa. So what do we know about PrEP? So we know that PrEP access is increasing. We know that there's a long-acting injectable form of PrEP that is currently being discussed, that is being piloted, and that is still being researched to see if it can be accessible to the general public in a safe way. We know that there's massive misinformation around PrEP or around the role of PrEP in fertility, about the side effects of PrEP, about who PrEP is for and who it isn't for. So in this video, as I said, I will be busting some common myths around PrEP that are still spreading and are frankly harming people. So the first myth is that PrEP is only for gay men. Fact is, PrEP is for anyone who is HIV negative and who is at risk of getting HIV. Those are the two important basic factors that you need to have before you can even think about PrEP. HIV negative and be at risk of getting HIV before you can even consider taking PrEP, right? And then if you meet any of the following criteria, you can request PrEP, right? So if you have a partner, for instance, who's HIV positive and who is not on ART stands for antiretroviral therapy, or what we commonly call ARVs. So if you have a partner who's HIV positive who is not on ART and who is not yet virally suppressed, then you meet the criteria for PrEP. If you are sexually active in a high HIV prevalence population, and if your sexual partner is HIV positive, if you were diagnosed with an STI in the past 6 months as well, you qualify for PrEP. If you have used PEP in the past, so notice I said PEP, not PrEP. PEP is post-exposure prophylaxis. It's different from PrEP, but I'll tell you more about it later in the video. If you are breastfeeding from an HIV positive person, I think this mostly applies to babies, I hope. And if you are injecting shed needles, then yes, you can get PrEP. So overall, no, PrEP is not only for gay men. Myth number 2, you don't need to use condoms if you are taking PrEP. This is not true. PrEP prevents HIV from multiplying in the body, right? It has nothing to do with all the other things that condoms could protect you from, essentially. So you still need to use condoms if you need protection from other STIs like chlamydia, syphilis, gonorrhea, genital herpes, etc., etc. The list is long. So you do need to use condoms, even if you are taking PrEP, if you want to protect yourself from other things that condoms protect you from. Myth number 3, you only need to take PrEP after having unprotected sex. This is not true, and it's in the name. So PrEP is pre-exposure. It's not after you've been exposed. So you have to take PrEP consistently for it to protect you from HIV. So if you think you've been exposed to HIV for whatever reason, then the drug that you're going to take is PEP, is post-exposure prophylaxis, right? So there's the pill that you can take after having sex where you think you could have been exposed to the virus. So when you take PEP, it's usually recommended that you take it within 72 hours of possible exposure. It's very effective in preventing HIV, but PEP is mostly for emergencies. The way that I think about it, for me, PEP is usually equated to the morning after pill. It's like that thing that you take if you think, oh flip, something happened. But again, ideally you don't want to be in those situations too often, right? So yeah, it's generally not a place that you want to be in a lot. And then myth number 4 is that PrEP is the same as ARVs. This is not true. Some of the ingredients between PrEP and ARVs may be similar, but usually what varies will be the dose, it will be the combination, because these two drugs have different goals, right? You take PrEP to prevent HIV from happening in the first place, and you take ARVs to treat HIV once you already have acquired the virus. So no, they're not equivalent. So that is something you need to keep in mind. Again, PrEP is taken by people that are HIV negative, whereas ARVs are taken by people who are living with HIV. Remember the difference. It's very important. Myth number 5 is that PrEP can prevent or treat other STIs besides HIV. This is not true. It's not true at all. Hence the point that I made earlier, you will need to use protection to protect yourself from other things. But PrEP it will work against HIV. It does not treat or prevent other STIs. And important thing, it's specifically designed to stop HIV from establishing an infection in the body. Nothing else, nothing more. That's all you need. You need to remember all of that. That's it. And not confuse it with all other things that could be in existence. Myth number 6 is that you have to take PrEP every day. Well, if you live in South Africa, currently the only option we have is the pill version of PrEP. That's the only one that is available to the general public. There is talks about the long-acting injection, which is already available in some parts of the world, but currently in South Africa, it's just in pilot studies. It is also in demonstration studies and in some research programs where they're still trying to make sure that, test it and to make sure that it's safe for everyone to use. So yes, you have to take the pill version of PrEP every day because that's the one option that we do have available to us currently in South Africa. So in a high HIV prevalence setting like South Africa, PrEP is about prevention. It's not about promiscuity and all these other things that it usually gets clumped up with. So knowing your options, for me, as I usually put it, is part of taking care of your health. Just know what's out there, know what's real and what's not, be able to decipher between the two and make better decisions for your health, for yourself. Again, if you found this video helpful, please like, share, and comment so that it can reach other people. And as always, let me know in the comments if there are any pressing health topics that you would like for me to tackle, and I shall do so. Till next time, bye-bye.